Good morning, New Jersey. My name is Aishwarya Billakurthi, and welcome to Cancer in 10 Minutes. Today we'll be discussing melanoma. With me today, I have reporter Safa Biradar, dermatologist Dr. Chauhan, and Dr. Goswami.
Thank you, Ms. Billakurthi. Recently, there has been a new discovery in a new treatment option for those diagnosed with melanoma. This treatment is called ipilimumab and was recently approved by the FDA as a treatment option of melanoma in stage 3 and 4 and recurrent melanoma in patients who had previously been treated with other chemotherapeutic agents.
So, what is melanoma? Well, melanoma is a very serious form of skin cancer. It begins in the melanocytes, that are the cells that produce melanin. Melanoma occurs when something goes wrong in these melanin producing cells. But when these cells develop DNA damage, new cells begin to grow out of control and they eventually form a mass of cancerous cells. Let's welcome and turn this over to Dr. Chauhan, who would like to explain more about what specific parts of the body melanoma generally affect.
Thank you, reporter. Now, melanoma is the most serious type of skin cancer, and as you said, it develops in the melanocytes that produce melanin. Melanomas can rarely develop anywhere on your body, but most often they develop in areas that have had a lot of exposure to the sun. Sometimes we get cases of melanoma occurring in places that don't receive much UV exposure, and these are called hidden melanoma, and they're more common in people with more melanin. Some examples of hidden melanomas are acral lentiginous melanoma, mucosal melanoma, and eye/ocular melanoma.
Thank you, doctor. From prior knowledge, I heard that UV rays play a vital role in melanoma. This is why we always hear about putting on sunscreen during the summer. Can you discuss what activities involving UV rays can trigger melanoma?
Yeah, and to answer that, UV rays don't actually cause all melanomas, but I'll get into that later. The exact cause of all melanomas isn't clear, but there are many risk factors for it. It's likely that a combination of these factors, including environmental and genetic ones, causes melanoma. That said, it's commonly believed that exposure to UV radiation from things like the sun and from tanning lamps and tanning beds is the leading cause of melanoma.
If you live at a high elevation, you're exposed to more UV radiation, which puts you at a higher risk of getting melanoma. Some risk factors include having less melanin in your skin, which means that you have less protection from UV radiation. To add on, if you have blonde or red hair, light-colored eyes, freckles, or you sunburn easily, you're more likely to develop melanoma. In addition, melanoma is more common in older people.
To add on to what Dr. Goswami was saying, people with weakened immune systems also have an increased risk of melanoma and other skin cancers too.
A commonly asked question I was wondering about is, can melanoma be inherited? I already know that melanoma itself cannot be inherited, though I believe you can inherit genetic information that increases the chance of developing melanoma. Specifically, however, what inherited conditions or information increases these chances?
Well, specifically, the two genes primarily responsible for this are called CDKN2A and CDK4, which play important roles in cell division. Both of these genes give a person an increased risk of melanoma if a mutation occurs in them. To add on, xeroderma pigmentosum, or XP, is an inherited condition that increases the chance of developing melanoma.
Is it true that a possible symptom of melanoma is unusual moles? Would you say that the first sign of melanoma being diagnosed would be a change in an existing mole?
Yes, I would. However, melanoma doesn't always begin as a mole. It can also occur on otherwise normal appearing skin.
In addition to what Dr. Chauhan was saying, having more than 50 ordinary moles on your body indicates an increased risk of melanoma. Having unusual moles, which are medically known as dysplastic nevi, increases the risk of melanoma. To determine if a mole is unusual or not, use the ABCD acronym as shown.
How is melanoma diagnosed and what tests do you perform?
So first, we ask questions about the patient's history to see if their chances are increased in any way. And when we check certain areas of your body for melanoma, we'll use the ABCD method on the area, and we'll also check if it's bleeding, oozing, or crusting. We may check the rest of the body for any suspicious moles or other spots that could be related to skin cancer.
So, what do lymph nodes have to do with melanoma and what exactly are they?
So lymph nodes are small bean-sized collections of immune cells, and we normally check for them under the skin in the neck, underarms, or groin near the abnormal area. If a doctor thinks a certain spot might be the melanoma, The area in question will be removed and sent to a lab to be looked at under a microscope. This is called a skin biopsy.
How do you perform skin biopsies? Is it just as simple as cutting the questioned area and sending it to some lab?
Yeah, I can elaborate on them for you. So skin biopsies are done using a local anesthetic, which is injected into the area with a very small needle. Keep in mind that anesthetics are types of numbing medicines. You will likely feel a small prick and a stinging as the medicine is injected, but you shouldn't be able to feel any pain during the skin biopsy. There are many different subcategories of skin biopsies, and if you don't mind, I'll explain them a little more.
Yeah, go ahead.
Okay. This is an example of a shave biopsy. Doctors will cut around the pigmented area and cut till the epidermis to remove and further inspect the skin sample. This next one is a punch biopsy. During a punch biopsy, the doctor uses a round cookie cutter-like tool to remove a deeper sample of skin. The doctor will rotate the punch biopsy tool on the skin until it cuts through all the layers of the skin. The sample is then removed and the edges of the biopsy site are often stitched together. Lastly, this is an excisional biopsy. An excisional biopsy removes the entire tumor along with a small margin of normal skin around it. This is usually the less preferred method of biopsy for suspected melanomas because it removes healthy tissues and makes for a more difficult recovery.
And if the doctor can't tell for sure if melanoma cells are in the sample just by looking at it, will they do some type of special lab test on the cell to try to confirm the diagnosis? And if so, would these tests include IHC, FISH, CGH, or GEP?
Yes, those would be the tests that are done.
Another commonly asked question that I would like to answer is, what scans and tests are done? A chest x-ray can be done to help determine if melanoma has spread to the lungs, although a CT scan of the chest is often done instead, unlike a regular x-ray. MRI scans, however, use radio waves and strong magnets instead of x-rays to create detailed images of parts of your body. Another option is a PET scan. A PET scan can help show if the cancer has spread to lymph nodes or other parts of the body. By the way, how common is melanoma?
Well, yearly about 100,350 adults in the US are diagnosed with invasive melanoma of the skin. Skin cancer is the most common cancer in the United States, but the diagnosed cases of melanoma are only about 1% of all skin cancer cases. Specifically, cutaneous melanoma, or melanoma that occurs on the skin, is in about 95% of cases of melanoma. Most of this melanoma only affects the outer layer of skin, known as the epidermis. 5% of melanoma cases occur in areas aside from the skin, such as the eyes.
What can be done to prevent getting this cancer?
Limiting your exposure to UV radiation can reduce your risk of getting melanoma. Make sure to avoid the sun during the middle of the day. For many people in North America, the sun's rays are strongest between about 10 a.m. and 4 p.m. Schedule outdoor activities for other times of the day, even in winter or when the sky is cloudy. Also, wear your sunscreen year-round and protective clothing. An example of this is sunglasses that block both UVA and UVB rays, or wearing lighter colored clothing. Avoid tanning lamps and tanning beds, and become familiar with your skin so you can notice changes in it. Examine your skin often for new skin growths or changes in existing moles, freckles, bumps, and birthmarks.
Thank you, doctor. How is the cancer treated? Are there specific medications or surgeries done?
When treating stage 0 melanoma, meaning that the tumor is no deeper than the epidermis, a surgery is needed to remove it. In this case, the surgery is a wide excision. Some doctors may even use imiquimod for stage 0 melanomas. Imiquimod is an anti-tumor medication and it can lower a raised area of skin. Imiquimod is often used in sensitive areas such as the face where surgery is a risky decision. The same thing occurs when dealing with stage 1 melanoma. Doctors surgically remove the melanoma and usually no other treatment is needed. However, if melanoma has been diagnosed already and it has concerning features such as being a certain thickness, if cancer is found in any nearby lymph nodes, they are either removed completely or observed carefully over time.
Or target therapy drugs may be given to prevent the cancer from spreading in the future. In stage 4 melanoma, it has already spread to distant lymph nodes. And at this point, surgery and radiation are a necessity.
Is radiation a way of treatment?
Some doctors may use radiation, but not all doctors agree with this method. It's only used when doctors can't perform surgery for whatever reason. Oftentimes, radiation is given after a lymph node removal surgery. This decreases the chances of the cancer returning to the body.
Thank you so much, doctors, for coming here today and being guests on this episode. Circling back to the beginning of this episode, there's been a recent advancement in melanoma treatment. The FDA recently approved ipilimumab for treatment of metastatic melanoma. Metastatic melanoma means melanoma in stages 3 and 4. The immediate result of using ipilimumab is increased immune activation, allowing the immune system to recognize and attack malignant cells.
I'm Safa, and I'm here today with Miss Billakurthi, Dr. Chauhan, and Dr. Goswami. And you just watched Cancer in 10 Minutes Melanoma Edition.
And if the doctor can't tell for